For centuries, dogs in the Philippines have been more than just companions. For most Filipinos in rural areas, dogs play an important role, protecting homes and property. But without adequate precautions, this important relationship with dogs can turn deadly.
The dog looked mad, its eyes red and always barking. I would have been bitten, but my uncle captured the dog and he was bitten instead.
Mary Rose's uncle died of rabies 2 months after he was bitten. A 5-year-old girl from Camarines Sur was also recently bitten by a rabid dog, and she too subsequently died.
I thought my daughter only had a normal fever. I had forgotten she was bitten by a dog. I told my husband that we must take her to the hospital immediately. The doctors looked for signs of rabies. They wanted to observe her for 24 hours, but she did not reach 24 hours. She passed away.
Of the estimated 200 human cases of rabies reported annually in the Philippines, all are the result of bites from rabid dogs. The Philippines has taken steps to eliminate rabies by 2020. It has established a multi-sectoral National Rabies Control and Prevention Committee and a strategy that is backed by legislation.
So we are lucky to have had a legal basis for this, and this is Republic Act 9482 or the Anti-Rabies Act of 2007. This gives mandate on what are the actions that need to be taken to address rabies.
The Department of Agriculture's Bureau of Animal Industry, or BAI, is taking the lead in eliminating rabies in dogs. This is one of the major thrusts of the country's national rabies control strategy.
The national target of our rabies control eradication strategy is to vaccinate 70% of the dog population nationwide. So that's why the government, the Department of Agriculture and the Department of Health has really put substantial amount of funds to procure vaccines that distributed nationwide through our regional rabies coordinators, which in turn coordinates with various local government units.
This target requires massive resources and support from local, national and international bodies. The government has increased tenfold BAI's budget for rabies control activities to 50 million pesos. Since 2014, the Department of Health has contributed to the procurement of dog vaccines.
Rabies is a zoonotic disease, and prevention and elimination of rabies can only be done through the control of rabies in the animal side. For this reason that last 2 years we have provided some funds to augment their dog vaccines in order for them to achieve the target of vaccinating at least 70%. In the next year in the budget, we're also proposing that we continue providing money to DA.
Additional funding has been provided by the World Organization for Animal Health, or OIE, through the STANS Rabies Project. The project helps BAI at the national and regional level. The OIE also supported the government of the Philippines to purchase affordable, quality rabies vaccines through its vaccine bank.
Project here in the Philippines specifically works on interventions on communication, technical interventions such as vaccination, case investigations, strengthening the coordination between the animal and human health sector, and strong political advocacy.
The Bicol region has been selected as a pilot area for animal rabies elimination. In 2011 and 2012, Albay province witnessed an increased number of human rabies deaths. With 100,000 doses of the rabies vaccine issued by the OIE Vaccine Bank, mass dog vaccinations were conducted in 2013, significantly reducing rabies cases. The STANS Rabies Project builds on this previous success.
The STANS Project Bicol covers 4 provinces, namely Masbate Province, Albay, Camarines Sur, and Camarines Norte. We really need the support of everyone. We really need to work together. And one agency cannot do it alone. We need help and support of other agencies involved, like the Department of Health, Education, the local government, NGOs, and the people's organization.
The project has trained barangay animal health workers and volunteers to conduct mass vaccination.
The volunteer vaccinators who are very committed in giving their service to prevent the spread of rabies in our community.
We don't mind the difficulties we experience reaching out to the remote areas under intense heat, as long as we have zero rabies casualties.
Breaking the cycle of rabies transmission from animals to humans through a targeted vaccination program could significantly reduce the need for costly treatment and prevent tragic and wholly unnecessary deaths.
One important fact also with rabies is that it only takes 10% of the cost spent on preventing it in humans through post-exposure treatment is needed to prevent this in animals through vaccination. Eliminating rabies in dogs means that eliminated in humans.
Other crucial components in the continuing fight against rabies include the training of dog catchers, outbreak investigation and response, and stray dog management. Each should be complementary and should be done in all provinces.
We immediately organised a vaccination campaign here. We went to all the corners of Barangay Gang Now and reached 90% of the dogs here, or a total of 270. Now we're happy and confident that we did our job well. Every municipality should have the same program as we have here. If only Naga City has this program and others don't, we will not meet our target of a rabies-free region.
These activities are being supported by a public awareness campaign to address the issue of low knowledge levels regarding rabies and how it's transmitted.
We need to inform owners about responsible pet ownership as well as what is the disease all about. It's important that they understand the grave threats that bring about rabies in humans as well as in animals.
These collaborative efforts are starting to show promising results.
We get a very positive response from the communities. They greatly appreciate the vaccinations being done right here in the village. It's unusual for them not to have to go very far to have their dogs vaccinated.
Sustaining these activities relies on local government units whose leadership and political commitment is crucial in eradicating rabies across the Philippines.
In the province of Masbate, we allocated 1 million pesos. And it's solely for anti-rabies campaign. Our funding will continue in ensuring that the anti-rabies campaign will be sustained.
There is still much that needs to be done, but the Department of Agriculture is confident that with the cooperation and support of every Filipino, the target of eliminating rabies in dogs can be achieved.
There is a complete cooperation between the government and the non-government organizations. This campaign is not an ordinary campaign, but everybody's concerned. Every Filipino should know the relevance of rabies eradication in this country.
The fight against rabies in the Philippines continues apace. Both the public and private sector, as well as the population at large, is increasing their involvement, recognizing that each rabies death in the Philippines is one too many.